Good evening, everyone. Today we have joined here to discuss a very important topic on behalf of Savera Cancer Hospital, Team Pollen, and Rotary Patna Midtown. So, we have come here to discuss the importance of nutrition in chemotherapy and radiation therapy. Basically, the dietary concerns are sometimes the last one to be looked at, but it is very important. There are few things which need to be addressed when we are treating patients of cancer because the demand, the body demand, nutrition demand, and the catabolic state is very different from other patients. So, what are those differences and what measures we can take has to be looked upon thoroughly. Am I audible clearly?
Yes,
Yes,
Okay.
yes.
So, understanding chemotherapy for a brief review, we need to know about the dietary adjustments, the hydration, important nutrient-rich foods, and the professional consultation. So many a times we know overall that nutritional changes they help us manage the side effects and improve the tolerance and the treatment. Hydration is a very important part because it forms the basis, the solvent for all the chemotherapy drugs that we administer in the body. Nutrient rich foods for the immunity supplement and professional consultation because as we discussed that the demands are very much different from the normal patients. So there are specific dietitians who cater to onco patients. So we will come to each point in detail. But most importantly, we have to screen the patient for malnutrition because all patients are not in a malnutrition state, but still how do we come to know that whether a patient is deficient in nutrition? So the data is alarming that nearly 30 to 80% of the cancer patients that develop malnutrition depending upon the cancer type, whether in the early course of the disease or in the later part. Early nutritional intervention, that is intervening before the malnutrition sets in, is very important. It improves the treatment completion and reduces hospitalizations because due to malnutrition, lack of adequate nutritional support, many a times treatment breaks are there, which are minimized when we do early nutritional intervention. Very important point of concern is sarcopenia. Sarcopenia is where patients lose muscle, and losing muscle is not just by body weight because many a times patient maintain the healthy body weight, but they have loss of muscles. The most common test to assess sarcopenia is the hand grip test. Patients are asked for a hand grip test, and that assesses the power of the muscles. So, to combat sarcopenia, the daily recommendation is around 1.2 to 2 gram per kg per day of protein, but this amount varies depending upon the clinical status. First and foremost, we have to understand that all guidelines are just guidelines. There has to be made differences in those guidelines, patient specific, depending upon the clinical status, the type of cancer, and the background. Light resistant exercises are advocated just to maintain the muscle mass. Understanding radiation therapy, because why I'm emphasizing on understanding radiation therapy, because many a times we know that chemotherapy, everybody know that we administer chemo drugs and it goes into the body and through blood and it is spread everywhere. But radiation therapy, there is a little less awareness about it. It is a localized treatment. But in spite of localized treatment, the nutritional assessment has a very great impact on the treatment completion, specifically in patients of head and neck cancers. Because in head and neck cancers, when we give radiation, they have oral mucositis all over the mouth and dysphagia in the so, in that case, nutritional support is very important because support before starting radiation, during radiation, and after radiation, they are taken up into three phases depending upon how much dysphagia or mucositis the patient is having. Secondly, when the patient is of abdominal or pelvic diseases, again, they have so much of discomfort, like if the patient is being treated in stomach or GI system or gallbladder, so they will always have dyspepsia and nausea. If it is a pelvic radiation, they will suffer from burning, micturition, tenesmus, and loose stools. So, site specific, whether it is head and neck, GI, or pelvic radiation, the nutritional assessment has to be done. So, proper nutrition helps manage common side effects of radiation therapy, such as fatigue and nausea, as we just now discussed, providing patients with the energy they need and improving their quality of life. Nutritional strategies during radiation therapy: the first and foremost, remain hydrated. Drink at least 8 glasses of water to maintain a healthy hydration. High protein food, especially lean proteins like legumes and nuts and lean meat, are incorporated. The meal should be small and frequent meal, which is in general a common recommendation for all people, with nutrient dense snacks. Now here, nutrient dense snacks has a very important role. Why? Because when a patient is undergoing treatment, they have a loss of appetite, and also they have if they have GI upset or oral mucositis, difficulty swallowing, so they will not be able to take a large amount of food at once. Those patients who are taking a small amount of food, so that needs to be nutrient dense, because if it is not sufficient in nutrition, then the patient will ultimately move into a catabolic phase and result in weight loss and muscle loss. Processed foods had to be limited, and proper weight monitoring along with professional nutritionist consultation. So this is an overview of chemo and radiotherapy. So basically, the main factor behind all these problems is the oxidative stress. There are free radicals, and they act on the normal tissue. Although radiation acts on the principle of free radicals, but still the free radicals which are generated, they do not spare your normal tissue. They go there, they act there, and they cause tissue damage. They cause damage to the GI lining, they cause damage to the rectal linings, and so we have different difficulties. So basically, we have digestibility issue, muscle loss, fat loss, fatigue, loss of appetite, palatability issues, that is loss of taste or altered taste. Uh, so these all things come region specific, the area where radiation is being given. Also, why? So now here comes the role of whey protein. Whey protein helps in muscle building, but also there is a very important role of its active component, that is HMB. HMB is the active component which helps in preventing muscle loss. So the common nutritional challenges that the cancer patients encounter. We have already discussed appetite loss. Patient often experience reduced appetite leading to inadequate calorie intakes, which can affect treatment outcome recovery. Taste changes. Cancer treatments can alter taste perception, making food unappealing. So, strategy should be there to experiment with different flavors so that people can maintain a balanced nutritional uptake. Coming to side specific food items which should be included, like if a patient is suffering from oral mucositis, I have tried to make the slide simpler so that we can get an overall like viewpoint of how to deal with patients who are suffering from different stages, side effects from different stages of treatment, and why it is important. So if a patient has oral mucositis, whether it is due to chemotherapy or due to radiation therapy, cold and soft food are preferred. Spicy and citrus foods are avoided. Why? Because these citrus foods usually cause irritation to the mucosa and further aggravates the mucositis. Many a times we have things that patient visits us in OPD, and they are like कि जूस पिला रहे हैं, and they are very keen to make the patient drink the juice, the attendants, but they are not visualizing the thing that juices, they have this citrus component, and they are ultimately irritating the mucosa and increasing the reaction. So citrus and spicy food should be avoided in patients who are suffering from oral mucositis. Cold and soft foods are preferred. Xerostomia means dry mouth. Patients have loss of saliva, salivas are dried up, and which leads to difficulty in swallowing, chewing, and moving the food around in their mouth. So, frequent sips of water, food with gravies are preferred so that they can be swallowed easily. Sugar free gums are advised so that their mouth is continuously in the chewing action, which leads to a kind of exercise to the salivary glands and hence helps in relieving xerostomia. Taste changes, lemons and herbs are very much beneficial. If a patient is suffering from diarrhea, then ORS, banana, fibers should be included, but oily food have to be avoided. Similarly, for constipation, many a times patients who are undergoing pelvic radiation, green leafy vegetables are asked to be avoided in those patients because though causes constipation. And along with constipation, when we are giving pelvic radiation, the rectal mucosa it becomes very thin and friable, so hard stools can irritate the rectal mucosa and cause rectal bleeding. Hence, it is better said to avoid constipation when a patient is undergoing pelvic radiation. Nausea is a very common side effect involving all the chemotherapy drugs and the radiation many a times. So, small frequent meals, ginger infused meals, and low glycemic load foods are preferred here. What is the role of micronutrients? Micronutrients are many a times overlooked, and we don't. Many a times we concentrate ourselves to vitamin D and vitamin B12, but we ignore smaller components as selenium, magnesium, zinc, etc. So, vitamin D helps to improve the overall outcome and survival rates. Similarly, magnesium, zinc helps in boosting immunity, reduces fatigue, promotes healing, and prevents nausea. Calcium and vitamin D are very important components for bone health, and it also enhances the nutrient absorption, cell repair, and maintains hydration. So, potassium, sodium, calcium, and vitamin D have to be majorly looked upon. Magnesium and zinc are to be followed so that we don't miss the smaller components here. Whey protein is the most commonly asked question. Patients usually come to us then say what kind of protein we should give to the patient. What should we give them? Horlicks, which is most commonly found in our household. Horlicks and Protein-X, two components I'm always encountering that can we give Horlicks to the patient. My point is we have to see that what the patient needs. Patient is in a loss in a sarcopenia state. Patient needs HMB as the active component. It comes from whey. Many a times people have a misconception that whey proteins are used by bodybuilders and used in gym. It is not like that. We we many of us don't know from where the whey protein comes from. So basically, when we prepare paneer from milk, the water that is left behind that contains whey. That is dried and powderized form and then sold as whey protein. So those who cannot afford protein, they can simply bring out paneer from the milk and drink the remaining water. That way, their protein requirement to some extent will be fulfilled. Concentrated whey protein has an exceptional nutritional supplement for cancer patients and recovering from chemotherapy and radiation treatment. It has significant benefits, as we discussed right now, that improves the body weight and composition in malnourished patients, supports sleep, maintains during treatment, essential amino acids are provided, and superior digestion as compared to other proteins. MCT oils, that is medium chain triglycerides, are specialized fats that are easily absorbed and metabolized than long chain triglycerides. Because since the GI tract is disturbed, so we don't prefer complex fats or complex carbohydrates. So, in that way, we can basically take primary source as medium chain triglycerides. Right now, we got a question that differentiate between whey isolate and whey concentrate. Exactly, I'm not very much sure about it, but whey, we for a cancer patients we take whey concentrate. Whey isolate is pure whey, where even the amino acids and the triglycerides which are infused there along with the whey is also removed, and it is pure protein. So isolate is not preferred for cancer patients because cancer patients have difficulty in digestion, and isolate sometimes causes more bloating as compared to the concentrate. So we have special preparations for patients in which whey protein, 30 to 44 gram per 100 gram, is provided to the patients. Usually, the normal over the counter whey proteins which are available in the market, we don't usually prefer that, because for cancer patients, when special preparations are there, along with whey concentrate, these medium chain triglycerides, amino acids, and calorie dense composition is also included, so that their catabolic demand is also taken into account. Which cancer patients benefit most from HMB? Patients, any patient who is undergoing a muscle loss, because if you have joined from the first, you must have seen that I have shared a slide that muscle loss is not generally that is not in one go. It is like divided in full day, like in the twice daily or thrice daily doses. It is not in one go because the scoops are divided according to the dietary recommendation in the whole day. Coming to the HMB thing, any person who has undergone a muscle loss, because body weight does not denotes muscle loss. Many a times body weight is maintained, but there is muscle loss, which is test by hand grip test. So any patient who has a low hand grip or a medium hand grip or has a evident muscle loss will benefit from HMB. Coming to L-glutamine, nowadays, if we have been to OPDs, and many a times we have so much of marketing of L-glutamine, that L-glutamine support is very necessary. We as practitioners also include L-glutamine in our in practice. So it is basically amino acid which helps in crucial recovery from cancer treatment, and it serves as a primary fuel for rapidly dividing cells. So many a times L-glutamine helps us in better recovery, better mucositis healing, and better GI tract healing. So, the key benefits usually is it reduces the severity and duration of oral mucositis. Many a times we include L-glutamine towards the end of the treatment, and then we continue it for 1 month after treatment. It accelerates the healing of GI tract, improves lymphocyte recovery, and it also provides as a substrate for glutathione synthesis, which is a key antioxidant. Keep this point in mind because we will come to the use of antioxidants during radiation therapy, and uh, it is a very important point why L-glutamine is included towards the end of the treatment and then continued after treatment rather than incorporating it from the first day of the treatment. We will come back to that point when I come to the point of use of antioxidants. So, coming to fiber, okay, fiber, we all know that it is very crucial for all the GI health, prebiotics and probiotics. It promotes growth of beneficial gut bacteria, reduces the risk of colorectal cancer in general population, weight management, and also glycemic control. Selenium is a very important antioxidant and has a very strong immune support. It reduces inflammation and oxidative stress and basically protects cardiac tissue from chemotherapy toxicity, but it is used in very small amount and important for our thyroid health also. Our nucleotides are ribonucleotides which help in post-treatment recovery in protein synthesis and infection control and immunity, but not very popular as components during the dietary planning. Now, coming to this slide, we are going to talk here about sugar low nutrition, its importance and option. So, why sugar low nutrition? uh, there is a question which I encounter on daily basis in OPD, that cancer patients should not be given sugar because cancer cells feed on sugar, and so giving sugar to cancer patient will increase the cancer or spread the cancer. First of all, it is a myth that giving sugar to a cancer patient will increase the cancer. Glucose is a very important part of our diet, because it is not only the cancer cells, it is the brain cells, the neurons, the RBCs, hemoglobin, the liver cells. They all take up glucose for their activity. So, in pursuit of starving the cancer cells, we are even starving our normal cells of the body. So, everything has to be in optimization. So, rather than a sugar free nutrition, we should go on a low sugar nutrition and specifically avoid refined sugars that are available from natural sources like fruits and all. They are absolutely safe to take, and they are very important for general body metabolism also. Similarly, gluten low, after no sugar no gluten is the newer concept. That first they have targeted sugar, that sugar should not be taken. Okay, I agree that refined sugar is harmful, but sugar available from natural sources are beneficial for the body. Similarly, low gluten, people nowadays are saying that gluten is a irritable thing, and people should not take gluten. A majority of the population has gluten sensitivity, I agree to that. Those people who have gluten sensitivity or are suffering from any inflammatory bowel disease, irritable bowel syndrome, celiac disease, they have to avoid gluten. But in general, gluten has not to be like totally omitted from the diet, because it also helps to build your this stabilize your glycemic levels. So those specifically in GI tract involvement, where the cases are there, gluten can be minimized, because due to disturbed or damaged GI tract, the absorption is difficult and it might cause bloating and discomfort and diarrhea or loose stool some. But in general, gluten free is not a recommendation. People should take it in balanced amount. So low sugar and low gluten, we are not talking about sugar free or gluten free. Those who have an absolute contraindication due to any disease, they are exceptions. Now this slide is about oral nutritional supplements. If you all remember that nowadays a very I also come across, we all scroll Instagram and social media. Some ads are very famous nowadays that these are the meal supplements for weight loss. Take these meal supplements at night, have it in dinner, no need to have food, just take the meal supplements and go for weight loss. And people are popularizing the meal supplements. Why? Due to two three reasons. First, they don't have to cook. Secondly, it is very easy. You just mix it and drink it. And third, less time. People are busier nowadays. But what we are not visualizing, that these habits will affect us in long term. Oral nutritional supplements have to be taken as supplements only. They are not replacements, because the the naturally available diet has a greater this immunomodulating role on our body than just taking supplements. ONS is a supplement. My first line is oral nutritional supplements are supplements. They do not replace regular meal. They supplement it. They help you grow. So what is the purpose? So it is used to support patients who cannot meet their nutritional needs through regular food, helping improve weight, muscle mass recovery, and overall clinical outcomes, like preventing malnutrition and its management, supporting the recovery, as we have right now discussed that nutrition is important for recovery and everything, disease specific nutrition therapy, weight gain and maintenance of weight. So those who are not able to take food, who are not able to take normal diet and cannot maintain their like body weight on normal diet, oral nutritional supplements are advised. Those who can maintain their oral diet but are deficient in some of the components, like their diet is not rich in protein or not rich in calorie, or amino acids or any other supplements, like many a times we take supplements as fish oil, omega 3 oils, amino acids, creatine, etc. So these all has to be supplemented with your oral natural diet, which you take in the form of food, and which is digested with your in your gut and excreted out as a roughage in your rectum. So supplements has to always act as supplements, not as replacements. What are the benefits? It improves the nutritional status, it enhances the muscle function and strength, faster recovery, and when the nutritional requirements are fulfilled, are up at the par, it leads to reduced hospitalizations and a very important point, completing the treatment in time. It causes lesser treatment breaks, and thus any cancer treatment with lesser breaks is more effective. Patients you'll see who have more breaks in treatment due to like decrease in blood counts or poor general condition, they usually have like poorer prognosis as compared to those patients who have completed treatment without any break. Coming to immunonutrition, just now we talked about omega 3 fatty acids. So these are important for cachexia actor supplements. Arginine is helpful for selected surgical patients. Now, here I'll emphasize the point of antioxidants. Previously, when you remember, we were talking about L-glutamine, we said that it acts as a like base for glutathione, which is an antioxidant. But glutamine is added towards the end of the therapy and continued after the completion of therapy rather than incorporating it from the day one of any cancer therapy. Why? High dose antioxidants are avoided during active radiotherapy. Now, what is the reason? I have not written here, I'll explain it in short. Radiation works on the principle of oxidation. Radiation enters our body, it breaks the water molecules, free radical oxygens are released. They go through a two, three mechanisms, which I'll not explain in detail. Like they go, they hit the hemoglobin, another free radicals are generated. And then these free radicals go and damage the DNA, which ultimately kills the cancer cells. So, DNA damage by radiation works on the principle of oxidation. Radiation produces free radicals, and those free radicals go and kill the cancer cell DNA. Now, if you will incorporate a high dose antioxidant from day one of therapy, it will act against the principle of radiation. So, the effect will be suboptimal. It will scavenge the free radicals the radiation is producing. So, on one hand, you are giving radiation to produce free radicals, and on the other hand, you are incorporating antioxidants. So, many people don't have this concept, and many a times, what they do, ki as a general rule, they like prescribe antioxidants from day one of the treatment. But it has to be physician directed and not self directed. Food safety during chemotherapy. Wash fruits and vegetables thoroughly. This is a very people might think that it is a very normal point everybody know, but while chemotherapy it becomes very important. Washing fruits and vegetables and avoiding raw meat, sushi or unpasteurized milk, because chemotherapy has an immunosuppressive effect on a body, and slightest of infection or external agent can trigger allergic reaction or infections in a body out of proportion to the general population. So these things has to be taken care well while a patient is on treatment. Eating freshly cooked food is always beneficial, and maintaining kitchen hygiene for all the same reasons as we discussed. Myths and facts, as now we have discussed all, we are almost coming towards the end of the presentation. We have discussed the slides. So, sugar feeds cancer is a myth. It is false. We right now discuss that cancer cells are fastly metabolizing cells. So any cell which is fastly metabolizing will need glucose, will need sugar, but starving cancer cells on the pretext of starving all the other cells is wrong. So if you will have this concept that sugar feeds cancer, sugar doesn't only feed cancer, it feeds all the cells of the body. All fat, protein, nutrient, they are ultimately converted into simpler carbohydrate forms, simpler fat forms, simpler protein forms. Important is we have to avoid refined sugar. Second point, starving kills cancer. I have encountered a patient who was on taking meal once a day. He was a patient himself, taking meal once a day and doing all the chemotherapy and radiotherapy without having any food. I asked him that this is not okay, like I will hold your radiation. And he was having weight loss. Due to weight loss, his mucositis has increased, his GI symptoms has increased, but he was not ready to leave this idea that if he will starve his body, his cancer cells will vanish. Unfortunately, we have to stop the treatment in between due to severe malnutrition, and unfortunately, he was not able to complete the treatment. So, a myth can sometime have a life changing role in your treatment decisions. Every patient needs a gluten free diet. False. Medically selected patients have to be gluten free. And lastly, supplements can replace meals. False, because supplements are supplements, they are not replacements. What are the red flags which we have to consider as doctors when we see a patient? 10% of weight loss, BMI less than 18.5, severe dysphagia, persistent vomiting, and unable to eat almost more than 50% of the requirement for more than 5 days. Now, why I am emphasizing this? Because many a times people don't understand the need of prior nutritional replenishment before starting any therapy. A proper enteral or parenteral route for food has to be maintained before starting any therapy. So, any patient who has absolute dysphagia or not having food, first nutritional general condition build up has to be done, then any treatment has to be proceeded. The common Indian meal examples, many a times people ask that what can we give. Now, this is not the complete list, but the majority patients usually stick to these, and like moong dal, khichdi, dahi rice, paneer bhurji, egg bhujri, sattu, curd, soft idli like fermented foods, chicken soup, and dalia with or without milk, depending upon the lactose tolerability. So basically, these are the major points that we need to consider while we plan the nutritional requirement of the patient. Not only as dietitians, but as clinicians, we have to know that when a patient needs enteral support, parenteral support, or a nutritional replacement therapy. And then it is a major part when we can actually help the patient complete the treatment in time and without any breaks. Thank you.
Thank you, ma'am, for this valuable information.
Thank you.
Thank you so much.
Any questions? We can address that. Like we have two, three questions in between, but if anything else.
I think
Yeah,
all the
ma'am. Good evening.
questions are got answered.
Good evening.
Good evening.
Hope I'm audible.
Yes, yes, you are audible now.
Yeah, I'm from Hyderabad. So my one question is that this protein supplements, which definitely help for the patients to competently address the chemotherapy because it helps them. And what is the duration of this protein intake we need to take? How long we need to take during the period, or after that also we have to continue?
Sorry, during the period or?
Like radiation and chemotherapy period that cycles.
Okay,
Okay.
okay. Protein supplement have no contraindications. We were talking about antioxidants. Protein supplements, sometimes we incorporate even before starting with radiation therapy. Because me as a radiation oncologist, patients usually come to me after surgery. So they are on these riles tube feed or any other parenteral feeds. So when they come to me, I have to maintain their nutritional requirement first. So 2 3 days we take for radiation planning. That time I start with the nutritional counseling and I incorporate the supplements that time. Because during radiation, many a times due to GI upset or oral mucositis, the food intake is reduced. So we have to take care of it from the very beginning.
Yeah, and after the cycles are also completed, we still need to take the same quantity or the proportion of protein for the.
Usually advise them to take for next 2 months in the same quantity as they were taking during the radiation, because after radiation also the reactions they take almost 1 month to subside it, because the radiation reactions they come in a very gradual way. They don't come in first fraction or second fraction, they come after 5 or 7 fractions, and they will keep on slowly increasing till the completion of radiation, and they keep on increasing even after 5 to 7 days after the completion of radiation. Then you have a plateau phase, and then the reactions gradually start decreasing. So as a general timeline, I explained to the patients that in 1 or 1.5 months they will come, they will stay for 5-10 days, and then in next 1 month they will subside. So during this period when their body is recovering from chemotherapy or radiation side effects, I ask them to take the supplements in same quantity as during treatment. And once after 2 months we get a scan done, and we have the patient is recovered, the side effects is recovered, and the patient is taking food normally, we reduce the intake as, and we encourage them for their daily household meal, that whatever is being cooked in their home.
Thank you.
Very well explained, ma'am. Thank you.
Thank you so much.
Thank you for an enlightening talk. Thank you so much.
Thank you, ma'am. Thank you so much for joining me here.
So if anyone have any query or question, as ma'am has explained very well, and all the minor and major pointers ma'am has taken. So if any query is there, so please drop a message or you can directly ask the question.
Mm. Okay, like if you get the questions, you can forward it to me,
Definitely, ma'am. I'll forward it to you.
and we
And
can address it.
yeah,
Thank,
absolutely. And
thank
very soon in the next
you.
month, like 1st September, will be considered as the National Nutritional Week. So we would like to see you again in our webinars. It's well explanatory. We would like to be associated on this webinar. So everyone who is present here, give their valuable time. Thank you so much. And on behalf of Pollen, I'm Amrita Rakesh. Say thanks to everyone who has attended this webinar and asked the questions and make it more interactive. Thank you so much. And thank you special to Amrita Rakesh. Thank you.
Thank you, Ravish, and thank you to Team Pollen. Thank you so much. Good night.